Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guests today are from the Hispanic Health Council. First up in our first segment, it's Jose Ortiz, the president and CEO. First time on the show. Welcome to the show.
Well, good to be here.
And good to have you here. So to sort of start out, maybe sort of a basic general description of what the Hispanic Health Council is. I know it's gone through all kinds of changes recently, mergers, we'll get to that. But for people who don't know, the Hispanic Health Council, what is it?
Well, the Hispanic Health Council, we're an agency that does advocacy. We do services, we do research, and we do training. It's been around since 1978. It's been noted more for the research that we've done and throughout the years. And so some of our services, we work with women who may have been recovering from cancer. We have case management in the area of substance use, do HIV, prenatal care, breastfeeding, again, an array of services.
And in the second segment, we'll talk to Grace, who will get more in detail with some of those services.
Yeah, Grace has been with the agency for over 26 years, so she can get more into the details of the services that we provide in more detail than I can.
Now, Hispanic Health Council, does that indicate that you kind of cater to a particular demographic, so to speak?
Well, essentially, our mission space speaks about Latinos, but we also serve any underserved population. So our doors are open to anyone, frankly. But we are the Hispanic Health Council, primarily dealing with the Latino population.
We're going to get into your background and kind of where you got to where you are now. But the Hispanic Health Council, that name exists, and it has existed for a while, but recently some mergers. Talk about that a little bit, because and it really makes sense, don't you think?
Well, sure. I mean, the era of nonprofits in terms of funding is rapidly shrinking or diminishing, and so the idea then for these smaller agencies is to come together and form larger agencies, actually to survive.
Yeah.
The deal is a lot of these small agencies that are pretty much there's a lot of threat in terms of the funding. So 5 years from now, some of these smaller areas may not even exist. So the idea then is to come together in some kind of partnership, whether it's merger, other alliances, memorandums of agreement. We actually went through an entire process of exploring the best way that we can come together with some of the other agencies. And then we found out that the best thing for us to do actually was to indeed merge was the best solution for us, and so we wound up merging with two other agencies, and also because we needed more and more than efficiencies, we needed to expand our services and to have a statewide presence, which is, again, it bodes well for the funders if you're located in different areas of the state.
Now, you had the individual organizations before they came together, was there some redundancy where it made sense to have them merge anyway?
Again, it was more for the expansion of services rather for creating efficiency. So there was very little redundancy. What we did, for example, we merged with a program called Mi Casa in Hartford. Now, Mi Casa services the youth, something that we're not currently doing. Historically, we provided services for the youth, but that went away some years ago. So I wanted personally to pick up that population because it's our youth, Latino youth in particular, really have a lot of issues to deal with, including finishing school, needing mentoring, in some cases some mental health and substance abuse issues and so forth, childhood obesity, hear a lot about that. So we wanted to be able to pick up that population and provide the services that they drastically need. So that's one area, so there's no redundancy there.
Yeah.
The other area, in fact, it takes us to the city of New Haven. We're located in Hartford. We have offices now in New Haven and in Meriden. Now that population deals particularly with the HIV/AIDS population, and so in terms of medical health care. We also, more importantly, they also have, that office has, and that off by the Hispano Unido in New Haven. So they provide services, mental health and addiction. They have a license to provide those services. Now that brings an entirely new population into our services. And what it also does is that it creates a revenue stream that we don't have right now. So, for example, if you have a substance abuse mental health license, it's a fee-for-service system. So for every client that you see, you can bill Medicaid and get that third-party reimbursement. So that's, again,
right.
the reason for expansion of services is one, but also creating revenue streams. And so right now, we're talking about because of this merger, we're now going to develop a fund development office. We're going to have this fee-for-service with Medicaid. And our training, we do cultural competency training, and that training, again, provides income and revenue. So what I'm trying to establish is a way of expanding our services, create a statewide presence, and enhance our revenue streams, create different revenue streams.
And I would imagine in these economic times, even though we are supposedly coming out of the recession that existed, it's still difficult for a nonprofit to be able to request funds, but generate revenue in general, right?
Absolutely,
yeah.
Absolutely. And again, that's the main reason why we're establishing a fund development office, fee-for-service, and funding and fundraising, in fact.
Yeah, and that's an important aspect of any nonprofit fundraising events. Just going on shows like this to kind of create some awareness for those that might not have even known, at the very least, that the Hispanic Health Council has become what it is now, and it's merged, and all these services that are offered sort of under one umbrella.
Absolutely. Now, fundraising is key.
Yeah.
Now, but you have how to fundraise is important.
What the events you do, yeah.
Exactly. Well, there wasn't a lot of fundraising happening prior to my coming to the Hispanic Health Council. As soon as I got there, within a year or so of my being there, we did our first walkathon, and we brought in some needed revenue. It wasn't a lot, but it was a start. Now we have to build on that.
Right. The idea is to always get a little bit more the following year with the same event, or expand it, learn, from the year before, and just make it bigger.
That's important.
Yeah.
And also, by the way, what the merger also did was it established a board of directors. That's critically important. Now our board of directors went from 10 to 16. So we made sure to bring in new board members that can help with fundraising and fund development. And so that was key. And so we're going to be looking to our board to help us in terms of creating dollars by way of fund development.
They can go out and do their own thing as far as generating funds.
Actually,
yeah.
the days of board of directors now, it's all about helping the organization survive and creating revenues. And we have some really good board members. We have an array, by the way. It's not, our board members are very diverse. Now we have African Americans, we have whites, and we have Latinos.
Culturally, there's a diverse.
It's important.
Yeah.
It's important to have that. And again, it reflects kind of the more so the population we serve, because 51% of our board have to be by our bylaws Latino, and we have a Latino chairperson.
The diversity that you talk about almost makes the name Hispanic Health Council almost misleading, in the sense that you really do serve a larger portion of the community, right?
Well, we would. But
yeah.
Again, the majority of the folks that we serve are Latino. But again, it's important to note that our doors are open to everyone, not just Hispanic. So we may be looking, we're going to be entertaining now a strategic planning process. And we're also going to revisit what our mission is and what we're looking for in terms of challenges for the future.
Now, you mentioned offices in Hartford, Meriden, and New Haven. Those are, big cities, and it makes sense for them to be there, especially with the populations that you serve. Will you be trying to also get locations in other parts of the state that might not be served at this point?
Well, we've had some people that have approached us in that. But mergers, as you may know, it's really an arduous and painstaking process.
Sure is, yeah.
So we just underwent a merger with two agencies, and that's, you inherit rather assets, but you also inherit liabilities. So you have to address those issues, and before you can take another step forward, you have to really address. But my vision, you should know, when I was interviewed for this position, my vision was to expand the services, to create a statewide presence. Now, bear in mind that we have puppet shows that we do in the area of nutrition. So we're in 6 major cities anyway, in the schools. So we brought puppet shows to students throughout the six major cities in the state of Connecticut. But our office is in Hartford, Meriden, and New Haven.
People have questions what's the best thing for them to do? Go to the website? Can they call? And what kind of questions are they asking?
Actually, when we get calls, is primarily to seeking assistance.
Yeah.
And our office, we have the Hispanic, in our building, we have the Hispanic Health Council, but there's also other services that are there of people that we rent out to. Immigration, we have their dental. So our building really, sometimes we get calls about things that we don't provide service for, but we also have a good referral system.
Right.
Absolutely. The Hispanic Health Council is well known in the city of Hartford, actually throughout the state. So we get calls from all over the place.
When you became president and CEO, was the ball already rolling on the merger, or is that something that happened after you got in?
It happened after I got in.
So you're the one who got the ball rolling on that.
Well, what happened, and by the way, mergers oftentimes are seen as, like adversarial or acrimonious.
Yeah.
No.
Like a hostile takeover kind of a thing.
With us, is actually the people that we merged with actually approached me. And so we talked about it, and a very amicable process. And again, the first thing we did was to explore to see if indeed the merger was the way to go. And we hired a consultant to do that for us, so it wasn't arbitrary on my part. So it turned out to be a decent. So right now we're looking to how to come together, how to bring the finances. It's a very complicated process, but we have a really good infrastructure. We have good senior managers that can handle something of that magnitude.
What's a website for people to go to learn more, whether it's services or just get information in general?
It's the HispanicHealthCouncil.com.
We'll put a graphic up on the screen too. Also, you interested in maybe saying a few words in Espanol for those that might be watching?
Yeah, para los que están velando, el español mío no es muy bueno, pero los que están velando, nosotros participamos en el Hispanic Health Council. Y me pueden llamar a mí, yo soy el presidente del concilio. El número mío es 860-527-0856 con la extensión 300.
All right. President and CEO of the Hispanic Health Council, Jose Ortiz, pleasure having you on for this segment. We'll take a break and come back, and we'll get a little bit more into detail into the services that the Hispanic Health Council offers. So I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. We're here with the folks from the Hispanic Health Council. Up now, it's Grace. How do you pronounce your last name?
Damio.
Damio. She's the Director of Research and Service Initiatives. That's a lot to fit on a business card, by the way. But welcome to the show.
Thank you so much.
Picking up where Jose left off, because we're going to get into the specifics of the services, is there anything you wanted to add on to what Jose was talking about as more of a sort of a generic explanation of what you do at Hispanic Health Council?
Yeah, our mission is to improve the health and social well-being of Latinos and other diverse communities. So we have kind of a broad approach to that. Providing services that are directly about health topics and then health-related services that also improve people's health.
We talked a lot about the merger and how the Hispanic Health Council really has expanded now to offer a lot more because of the organizations that you've kind of absorbed or taken in. But when people, I know it's a wide range, but what's the biggest thing that people come to you for that they need help with?
Well, I wouldn't say there is any one thing.
Right, it's very diverse.
What we do really is we think about the lifespan. And we think about how we can improve health and social well-being, starting with really before people are born, all the way to older age. We do health promotion, which is prevention-oriented. And
it's so important these days, too.
Absolutely. And then we do what's really like secondary prevention, which is chronic disease management, so that outcomes are better. So people come to us for a wide variety of things, and they have to do with all different issues that they know that they can come to us, as Jose said, directly because we can help, or if we can't, we figure out where to send them.
How did they know about you in the first place? I know, it's been around for a long time, but how are you getting the word out?
Well, we have a 35-year history, and from the very beginning, our absolute premise was that we're in partnership with the communities that we serve. We're equals to the community we serve, and therefore we have the established relationship that's extremely important of trust, or in Spanish the word would be confianza. And that means that people feel safe with us. They feel they can come and therefore they can spread the word. And so when we look at our referral base, while every program has referrals from other kinds of providers, one of the biggest sources of people coming to us is word of mouth.
And that's the best type of advertisement that there is,
It's the best
isn't there?
compliment you could get.
Yeah.
Yeah.
And so they obviously are appreciative of your services, respect them, and also are happy enough with them to come back and to refer other people. So, I talked about getting into specifics of a lot of the services. What do you want to talk about that you'd like to get the word about as far as services in general?
Well, so I'll start with saying that when we figure out what service is needed, we do it again with the community. We are very strong believers in community voice and community input.
They tell you what they want.
They tell us what we want, and we do it in a systematic way that one would call research. But it shouldn't sound scary. What we really do is find a way to get a real read from community members on what their needs are, what their barriers are, what their problems are, and what kind of solutions might work for them. So we've developed over the years with that kind of input a variety of services. If we start with early in life, we have pregnant women that come as early in their pregnancy as possible. We work with them till 1 or 2 years postpartum, and with a very rigorous assessment, we then do case management to make sure they have health insurance, they have prenatal care, they have the education they need to take care of themselves and their babies. We look at oral health, we look at depression, we really look at the wide variety of barriers and strengths that they have to bring to the table to make sure that they're healthy and their babies are healthy. So that's sort of the beginning. To complement that, we have a nationally recognized breastfeeding peer counseling program. And that program operates in partnership with Hartford Hospital. We've also evaluated it with the CDC and replicated it at Yale New Haven WIC program.
Those are awfully good credentials there that you're mentioning.
Yeah. And so that program helps women decide to breastfeed, initiate breastfeeding in the hospital, and then breastfeed successfully at home. It's a very intensive and focused program on one health practice, but one that a lot of people have never seen anybody do, and it's one of the most important things a mother can do for a baby.
Now, when you say not a lot in the Hispanic community, or people in general, do you think, that haven't been, sort of had that in front of them to understand it?
Well, we've had decades of losing breastfeeding because the infant formula companies marketed it so they
True.
saturated.
Almost like a drug, a pharmaceutical company in a way.
They are pharmaceutical companies,
Yeah.
and in our view, formula should almost be like a pharmaceutical and be prescribed. But it was marketed so heavily to pediatricians and OBGYN doctors as well as to families that for some decades it was really lost in our country. And now it's been coming back, but in low-income communities, it happens to be a place where there needs to be more intensive work and support. So we're working more intensively with low-income people, and in the case of this program, it's the low-income people that attend Hartford Hospital's services. We've now begun to expand the program at St. Francis in the north end of the city as well. And like I said, there's a program that's of the same model operating at Yale New Haven.
So where you are, Hartford or New Haven, those programs are there and they
Yep.
exist. And obviously, you're an advocate of breastfeeding as opposed to, formula.
Breastfeeding is the gold standard, and it's actually one thing that may not be known. There's so many benefits. One of them is it's one of the most important practices for preventing childhood obesity and lifelong obesity. So it's important in that way too.
So that is one, and that's a very big one as far as your services. And I hear the passion in your voice about it and how important it is to you to maybe have as many people as possible participate in that. What else besides that?
Well, to complement that in maternal and child health, we have parenting programs that provide support, again, just before the baby's born, all the way through, for one of them, 5 years of time, to make sure that parents have the skills and support needed to be positive parents, and also there's a focus on child development and learning. So that cluster is really our maternal and child health cluster. We have another cluster in community nutrition, and Jose mentioned the puppet shows. They actually operate in 7 of the largest cities in the state. We have pre-K to 3rd grade getting puppet shows in every school in the cities we're in, and there are 6 puppet shows that all reinforce each other to give positive messages about healthy eating. That program along with the breastfeeding program and one other of our programs, were highlighted in a video that won an award from the Let's Move initiative of Michelle Obama.
No kidding.
So we
Wow.
visited the White House this past year.
Wow. Well, kind of talk
as an
about that
awardee.
experience a little bit.
Well, it was very exciting.
Yeah.
There was an initiative by Let's Move to have faith and community-based organizations better inform the First Lady and Let's Move about what they were doing to help prevent childhood obesity. So but the idea was to produce a video in 3 minutes or less and have it depict in some compelling way a program that's sort of scalable, that could be used by others and that shows best practice. So we combined 3 of our programs, and one of our puppets, whose name is Broccoli, was the MC.
He's a healthy puppet.
Yeah, that's right. And he walked, the audience through the 3 programs, and in a very kind of entertaining way. So at the end of the day, there were 9 awardees, and we were one of them. We got an honorable mention.
Wow, that's fantastic.
So we visited the White House and had a nice ceremony there with a number of prominent speakers. The First Lady spoke. And it was an honor to be part of all of that.
Now, for those that don't know, Let's Move is her initiative nationwide.
Yeah, and in many different ways,
Yeah.
she and her staff are putting out all different initiatives to try to make sure that people have the information they need to be physically active and eat well, and that different sectors of society take on ways to change menus and to change environments and to get communities active in moving forward and improving food that's available as well as what people actually eat.
Well, if for no other reason, you needed to come on the show today to tout that you won an award from the White House. So that's a
Yeah,
big
that
deal.
was great.
And are you telling everybody about that too? Hopefully it's on the website and your Facebook page
Yes,
and all that
yeah.
too, you know. I just kind of want to bounce around a little bit. As we tape today, it's sort of the beginning of the Affordable Health Care Act, and Connecticut as a state is getting the word out about that. How does that affect those who take advantage of your services, and can you help them in that area in any way?
Well, one of the other roles we play, which I hadn't mentioned, just to kind of finish there's maternal and child health, there's community nutrition. We also have a risk reduction unit that works on substance abuse, cancer, and also we're about to launch something in smoking cessation. But then all of those programs have had something to do with healthcare access.
Right.
But we have a whole new formal area now because we are one of the 6 navigators in the state.
What is a navigator?
What that means is that the way that this Affordable Care Act is being rolled out is there are many different ways to enter the marketplace,
Right.
which is really the array of different ways to get health care if you don't have it. And one of the ways is that there are navigators in each county, that's one, but there are also dozens of what are called assisters. And both the assisters and the navigator are trained and certified in how to, in a very informed way, help people understand how the Affordable Care Act works, how they can get health insurance, and to actually enroll them in health insurance by guiding them through their options and helping them make their own choice and then become enrolled.
Do you find that people find it to be a daunting task? Is it more complicated than it needs to be? Obviously, you're there to help, but haven't they kind of kicked off this campaign to kind of make it easy for everybody to have? But maybe it's not that easy.
Well, you know what? I think first of all, it's the first day, so
Right.
we don't really have sort of the report from the ground yet.
And by the way, I think the Hispanic version of the website, as we tape this, isn't even up and running 100% yet. It may be like a week or two before that one. English, yes. Hispanic, the Spanish version, maybe not so much yet, from what I understand.
Yeah, and I actually not sure of that. But
Yeah.
but what we've got, in-house is a way to help facilitate the process. The process, if we really think of it in simple terms, is not such a complicated thing. It's that if you don't have health insurance, there are a variety of ways to get it. People can get it without working through navigators and assisters. They can get it by phone, and they can get it by getting online.
Mm-hmm.
But we're a way to do face-to-face help because a lot of people really need someone to kind
feel
of
more
hold their hand
comfortable.
and walk
Right.
them through.
Right.
We do it computer-based. We get into the portal on the website, and then we can actually show them. We can plug in information about them and outcomes, what they're eligible for. We can walk them through their options. We can help them know what they mean and help them make a choice and then help them enroll. So for people that really do find it a little bit difficult to do, there's actually hands-on support that we ourselves will do, but we're also the technical support to an array of dozens of assisters, and those assisters are placed in places throughout the community to make sure that wherever somebody is, they can walk in, they can easily access somebody that can provide help to them.
And we're at the beginning stages of it now, but there is a deadline that people will have to kind of get going on this before a certain date, before there's some kind of a tax penalty for it, right?
Right.
Yeah.
Yeah, but there's a period of months right now that that people can really get a hold of this idea and look for help or enroll in whatever way works best for them.
I gave Jose the opportunity to speak in Espanol. Did you want to do that a little bit, or?
Puedo hablar un poquito en español si quisiera, para simplemente decir que nosotros estamos en Hartford, en Meriden y en New Haven. Tenemos muchos servicios y tenemos mucha información para el público, y que nos llamen en el número que José también dio, que es el 860-527-0856.
And there'll be the phone number and the website. We'll put a graphic up on the screen so people can go. What can they see on the website, by the way, when they go there?
The website has all of our programs. It has recent events that we've held at the council. It has information about our staff, our board, ways to donate, which we're always looking for. A variety of interesting information about us.
The Director of Research and Service Initiatives, that sounds right up your alley, like, that's perfect for you, because I can also hear the passion in your voice for it. So,
yes.
Grace, thanks for being on the show
Thank
today.
you so much.
And that is our show for today. I'm Sean Murphy. You can see this show and many others, by the way, on our YouTube site, so go check that out. In the meantime, this is For the Record. We will see you next time. Take care.